Wow, we've talked about so many things today, and we still have things to talk about, and indeed there are very, very interesting things. This system just gets more and more complex. We talked about how agriculture needs water, and water needs sanitation, at least for the moment. Maybe not in the future. Good sanitation and water supply has every impact on health, and health also depends on good agriculture. It just goes around and around and around the system, and it's fascinating. And we've been talking about how climate change is changing things and how it features in this system. So I'm going to invite Deborah to come back, Deborah Berlinck to come back, and this panel is going to look specifically at the health issues, so climate and health. Again, we're going to look at the challenges, but this time in this panel, we're also going to look at the solutions. So, Deborah, I give the floor to you.
Thank you. I'm delighted to be back. Have a commercial announcement. I'm selling my shoes. So, okay, we'll have a bid afterwards. So, I have the pleasure to introduce a very interesting and diverse panel, this time with two men. Let me start with Alexandra, Henrion, Caude. Yeah. She is Director of Research of Inserm, which is a French institute on medical health and research. She works at Hôpital, which is a major hospital, children's hospital in Paris, for those who don't know. She's a geneticist, and her work focuses on how environment impacts genetics and childhood diseases. Thank you, Alexandra. May I call Ildi Fenyvesi? Thank you. Ildi, she's a lecturer at the Division of Forensic Medicine and Pathology at the University of Witwatersrand. That's a very difficult name to pronounce. I did try my best in South Africa. She works at a mortuary. She will tell us how much dead bodies can tell about climate change. You don't be scared. I've got Sebbag, I'm trying to pronounce correctly, the French way. He is vice president of the pharmaceutical company Sanofi. He's a PhD in medicine and expert in infectious diseases such as palladium. And at Sanofi, he is in charge of access to medicines. Now, Nick Watts, British director of the Lancet Commission on Health and Climate Change, which those of you who don't know, we've got a very strange noise. It's my phone. It's the moderator's phone. That's serious. Okay, so Nick, he is the director of the Lancet Commission on Health and Climate Change, a world-renowned medical journal. So welcome, and thank you all for being here. Let me start with a general question, starting with Nick, but you all can answer. What impact climate change will have, or is having already, in the health of Africans and people from the small island states, such as Mauritius?
Sure. I think we've already heard earlier on in the day sort of some of the brief overview of the impact of climate change on human health and well-being. But when you really sort of dig down into it, what you find is that environmental change, climate change, impacts and threatens to undermine all of the social determinants, all of the economic determinants of public health. In a recent paper we published in the Lancet, looking to add up all of this, the suggestion is that it has the potential to undermine the last 50 years of gains in public health, which is colossal, and I think as the sort of commission and the journal calls it, a medical emergency, particularly in Africa, particularly in small island developing states. You see the exposure to these environmental extremes more pronounced. And so the sorts of things that we're talking about are anything from extreme weather events like storms, flooding, drought, the impact that that drought then has on famine, the impact that famine then has on undernutrition and stunting. We know that as a result of climate change by 2050, a medium estimate is that there will be an additional 25 million children under the age of 5 that are stunted, just as a result of famine caused from climate change. Moving from extreme weather events, you get extremes of temperature, either too much cold or too much heat, and the impact that that has on elderly populations and on children. You move on to some of the sorts of topics that I think other people on this panel are far more qualified to talk about in terms of infectious disease and the spread of vector-borne diseases that climate change brings, whether this is malaria, whether it's dengue, or whether it's cholera. And it really sort of starts up at some of those higher level sort of areas in terms of the direct impacts, but it makes its way the whole way through in terms of the impact that climate change has in undermining social systems, exacerbating poverty, driving mass migration and population displacement. We know these are terrible things for public health.
Okay.
The number that was used earlier on today, 250,000 deaths per year, is a gross underestimate. It's a number from the World Health Organization's report, which I was fortunate enough to help put together. It only considers some of those direct impacts. It doesn't consider the impact of migration. It doesn't consider the impact of poverty, and it has some very conservative, generous estimates about how well we'll be able to adapt. The impacts of climate change on human health, I would say, are absolute.
Thank you, Robert. So very strong words. Undermine 50 years of gains. That's a lot. Robert, what do you have to say about that?
Okay, first I think it's very good to speak about consequences on health with climate change at the end, because you say the link between agricultural, between water sanitation, and so on. I think everything is linked. This is the first point. The second one, perhaps I will say an advice to Nicolas Hulot, to you, Madame la Présidente. I think we have to speak a little more about the consequences on health and climate change. If we want a commitment of the population, we have to give them something very concrete. If you say they don't care about the planet, this type of thing, if you say you will have very quick consequences on health, on your children, I think it's very important, this type of commitment. It's why we have to speak a little more about health, because it's something very concrete. You say a few examples. If you take, I will tell you a catalog. I'm sorry to speak like that, but as a specialist, a catalog of some specific diseases. Vector-borne diseases, malaria. We know that Africa is touched by malaria. But you have some country with a warming, they didn't know malaria. If you take the island in Bolivia, in Ecuador, in Peru, the Anopheles above 2,500 meters and can live. Now with the warming, they will have malaria. They have no preparation in terms of the immune system. The same in some area around Ethiopia, high country, around Kilimanjaro. If you take dengue, now in France, we have some autochthonous cases of dengue, because the vector of dengue, the Aedes aegypti, Aedes albopictus, is in France, in 30 departments in France. And in my hospital, we have received 2 or 3 autochthonous cases of dengue. Take Zika. Zika is the West Indies. With a movement of population, we received 3 cases of women with Zika in France. The vector is here. And you have a sort of vicious circle. We can speak about chikungunya. We remember the outbreak in La Réunion. It's a risk also here in Mauritius. If you take Lyme disease, and I can give you many examples, respiratory disease with the pollution, with the biodiversity modification, you have some new plants and new allergy. Mm-hmm. If you take all the diarrhea with the water and the problem of sanitation, very important one. But I want to raise a very important one, is migration. Mm-hmm. We have 3 types of migration. We have political migration, we see from Middle East, economical migration because food problem, and we have seen and linked directly with health. And we have tomorrow and perhaps even today some climate migration. And you have one disease very few people speak, is tuberculosis. Okay. Latent TB. We know that the migrants, they are a target about TB, and we have a big increase of TB. And perhaps another example, they don't speak a lot, the stress. Stress links with warming and some mental disorder, some increase of depression. You take some example of countries, Marshall Island, Vanuatu, Maldives. We know that within 5 years, 10 years, 15 years, the rise of the ocean, they will probably disappear.
Okay.
You can imagine the people, they are living in this country, say perhaps my children, we don't know, my country will disappear. You can imagine how induce a sort of anxiety, a sort of depression, even mental health, and we have some statistics on this point of thing.
So an increase in depression and anxiety in small islands, for example, like
For
Mauritius.
sure. No, in Mauritius we have seen the coastal. No,
I'm taking
the
profit of the
coastal
president
erosion.
is here.
And when we know the place of tourism in this country, it's a big risk. Madame la Présidente, you say yesterday that Mauritius Island is the number 14 in terms of risk in the country. And I think it's very important to give the awareness of the population to say that, and the stress induced by this type of things.
So you have diseases, mosquito-borne diseases,
Oh, yes.
migrating from one place to another. Ildi, what dead bodies can tell about that?
Yes, we're really at the end of the chain, really, when it comes to the effects of potential climate change issues, and perhaps dealing with sick people or in a hospital or, you know, are being treated for an illness. Our population is totally unbiased. They come to our mortuary because they require a medical legal autopsy to be conducted. Their death was unexpected. It was due to unnatural causes, and we are there to help ascertain what the cause of death was. And what we do, or what we eventually find out, is once we open up the body, that yes, they might have been hit by a car, or they might have been shot, that they have underlying pathology and underlying health issues that may not have been known or might have gone undetected. And it's disconcerting that you know, we're walking time bombs, really, in a way. And we only actually find out how ill we are is unfortunately once we die. And coming from Johannesburg is a melting pot of all things Africa. A lot of people come to Johannesburg for work, to seek a better life, and unfortunately a lot of them succumb to accidents, suicides, homicides. And we actually can tell from a wide variety, a wide spectrum of the people out there that you know, they actually are quite ill. And that's what South Africa, or that's what Johannesburg in particular, can afford, is that we are able to assess people in that way. People might think it's too late, but you're dead, you know, what else can you tell us? But actually there's a lot that dead people can say.
So can you actually detect how the person was, if the dead, by analyzing a dead body, can you detect how this person was affected by climate change, for example?
Potentially, yes, but not directly. Because Johannesburg is a large metropolitan center, it forms part of Gauteng. Gauteng is home to 13.5 million people. Our mortuary deals with 3,500 deaths per year. You know, there really isn't the time to sit and to assess the full pathology. Our doctors, our pathologists, our scientists are really under pressure to just try and ascertain on a certain level what the cause of death was. But they do see a lot of pathology, a lot of interesting signs that there may be more at play within that person, more health issues that person may have been experiencing, and that could potentially be linked to climate change, to migration, and but there's just no time and no resources to spend looking at them all.
Thank you. Alexandra, I mean, you're a geneticist and you work with children in a major Parisian hospital. How important genetic is to explain health problems related to climate change?
First of all, I would like to draw the attention of the audience to wake them up a bit, because it may sound like another additional session that we're putting together, but actually it is not. And the reason why it is not is that only 1.5% of the international finance that is allocated to climate change is dedicated to health. So we are a minority showing up on stage here to speak about health in relation to climate change. Now, how does genetic relate in here? Well, genetic relates very straightforward, in a very straightforward manner, because what we are, what we look like, is basically the interaction of our genes, the programming of what we are, and the environment. So any sort of change within the temperature, the rain, any extreme weather will have tremendous effect. So that's one thing, and that I wish that one would put a slide on this aspect to show just the complexity of what we are talking about. What you just see on the chart is the relationship between the proteins of a single cell organism. Obviously, we are not one single cell, all of us, and it just shows how complex the system is to look at. So that's one thing. So the other thing is that we've been putting negative aspects to you, throwing threats. And in fact, what genetics teaches us very clearly is that it's time for opportunity. Any sort of change is a time for adaptation. And therefore, yes, there will be a geographic distribution of climate change, but this geographic distribution is a time of opportunity for other kind of distribution of possibility to react. And this is something that is a good news, in fact, that we can put together. With that, I would love to go on the definition of health, if you may. But I know that
I'm sorry, but Alexandra,
Oh,
just to establish a debate,
Let's
the problem is the lead time between the reaction and the reality. If you take Zika, all the specialists, we know that after perhaps 2 years, we will have a natural immunity of Zika. But in the meantime, you have people, and mainly ladies and pregnant women, with a risk of microcephaly, and people with a Guillain-Barré syndrome can induce death. Okay, but during these 2 years, we have to do something. And the same for many things. I agree. We can always react, but the problem is the lead time between the reality and the reaction.
Yeah, so that's about treating the consequences or treating the causes. And I'd rather go for treating the causes than the consequences. Because when treating the consequences, you may react in a way that you couldn't predict, that was not the appropriate way. You talk of malaria, and as a matter of fact, the data says that it's a very terrible question in Africa. It's about over 7% of death among children who are under the age of 5 years old that are due to malaria. But now we have those strange observations that 80% of the malaria cases take place in sub-Saharan Africa, where 70% of the third dose of a vaccine of diphtheria, tetanus, and pertussis have been put. So you're just like, you're always in sort of a balance where you have to understand what are the consequences of what you're doing. And if you rush for the treatment, maybe you're actually putting more disbalance into the possibility to react.
Okay.
But the responsibility of the doctor, I am sorry.
The two French.
I am sorry.
If you put two French together, that's
the responsibility of
what
a doctor
it
is to treat the people. I will give you an example about Morocco. I know that some people are coming from Morocco. Morocco and some other country in Maghreb, Algeria. Malaria disappeared completely. Now with the migration of population coming from sub-Saharan Africa, coming to Morocco to go the Spanish place to go in Europe, we have some autochthonous cases of malaria because with the warming we can find some Anopheles in Morocco. What can you do? You don't have to treat the people to say, okay, we will prevent some resistance to the compound. No, we have to do both. I think it's a link between what you're in terms of research, but also in terms of practitioner.
Let's not lose our track. We are talking of climate change and adaptation to climate change. You're talking of treating on the immediate observation that you're putting together.
We can speak about mitigation, I fully agree. But when we speak about climate change, you have adaptation, adaptation we have to find in terms of research, and with my head of pharmaceutical industry, about malaria, about vaccine, about the dengue vaccine that we have, about many tools. But in terms of mitigation also, it's very important because the pharma industries, they produce footprint gas. And we have to do which type of solution we have to do in terms of using of water, using of, instead of to take plane for the supply of drugs all around the world, we prefer boats, and so both in the two directions. But adaptation, I'm sorry, it's very important very quickly, but this is also the responsibility of the politician. If you take the Abuja declaration 2 years ago, they say we have to put 15% of the budget for health. It's not the case today. It's not the case, but we have also capacity building to create some infrastructure and so on. It's an emergency. Climate change or not climate change in terms of health.
Let me get back to Nick. Sorry.
A
Nick,
British between two French. That's a very strange way of being diplomatic.
Okay, Nick, you have gathered over 100 academics from different disciplines to look at the link between climate change and health. In summary, what are your key findings?
Sure. Firstly, that there is a desperate need for a balance between mitigation and adaptation, and no one disputes that. There is, we've had that argument has been had for 20 years, and I think has been long done. But yeah, the Lancet, as sort of one of the world's leading medical journals, convened a number of academic institutions, 33 academic institutions across Europe, Africa, and Asia, to look at the impacts of climate change on human health, but more importantly, to move beyond that and to look at what the implications of some of the solutions to climate change do to human health, positive or negative. And so there are a number of key findings that the Commission came through. I mentioned one of them earlier. It's around the potential of climate change to undermine the last 50 years of gains in public health. And this undermining that occurs isn't just something that happens in high-income countries, it happens in low and middle-income countries, it happens the whole way across the globe. The second key message is moving very quickly on from those negative impacts. It's that the response to climate change has the potential to be the biggest global health opportunity of the 21st century. Mm-hmm. And the reason for that is that we were a commission of economists, of engineers, of lawyers, of doctors, of nurses. And when we asked the engineers and the energy experts, and we asked the transport economists, and we asked the agricultural experts, what is it that you want to do to respond to climate change? They gave us a list of things, and all of the health professionals and the public health experts looked at those, and they said, oh, that's the sort of stuff we want to do as well. And as it turned out, when you looked at all of the different things that you want to do to respond to climate change, they're just sensible, cost-effective public health interventions in their own right. A good example of this is in the decarbonization of the energy sector. You look at the impact that coal-fired power has on human health. It was mentioned this morning, 7 million deaths as a result of air pollution. 3.7 million of those come from outdoor air pollution, and within that, 80% of those come from coal-fired power, come from a polluting energy system. You can shift away from coal-fired power towards renewable now in Africa, in parts of Africa, cheaper solar energy, wind energy, and yield not only the climate benefit, but huge health benefits. And these benefits are experienced immediately. So that's the second. First, it's a threat. Secondly, it's potentially a huge opportunity for public health. And the third message that came from the Lancet Commission was that all of this is possible. Mm-hmm. It was that when we looked at the sorts of technologies you need in renewable energy, when we looked at the sorts of technologies and strategies you need in transport, in agriculture, in indoor housing, in building efficiency, in public health systems, there were things that we knew how to do. There was nothing new there. And when you looked at the finance that was needed to be mobilized, that was something that, for the most part, our economists thought could be readily mobilized. It's not there yet, but it was something that was readily available, and the amount that was required to really get going on this wasn't actually as much as people were concerned about.
So, Robert, if technology is not a problem, if finance is not a problem, what is the problem?
Are you asking me or Robert? Me. Okay.
Oh, sorry. I had Robert in my mind.
You're okay.
Okay.
And that was the second part of the sentence, was that the response to climate change, moving from climate change as a threat to global health to being a benefit or being an opportunity for global health, is no longer a technological problem, it's no longer an economic problem, it's not a financial problem, it's a political problem. The response to climate change is entirely a political problem, and whether or not we do that and achieve those immense, immense benefits for public health, for Africa, for small island developing states, is now entirely a political question.
I'm even tempted to ask the president if she agrees with that. Okay. Robert, in Africa and small islands, many people cannot afford brand medicines from companies such as yours, such as Sanofi, nor can they afford to import generic medicine from India. You know, will climate change exacerbate this problem, and how can pharmaceutical companies contribute?
Climate change or not climate change and consequences, access is a problem. And access is a problem in terms of many things, but in terms also of price for the compound. I think now with a strong awareness by the majority of the company, because the social responsibility, the world is one. You say, Madame la Présidente, how is the global? And I think it's impossible to have a sort of difference between you have technical tools available in the north, not available in the south. And I think it's a strong awareness about to change the business model. When you see the reality of what they call the big pharma, I don't like the word, but it shows that the growth will come from the south. Cynically speaking, if they want to be present in the south and not to let only generics company, I have nothing against a Chinese company or Indian company, they have to adapt. And the adaptation is tier pricing, is to change really the business model and to change the theory in terms of high margin and low volume to big volume and low margin. I think this awareness is very strong today. If I take in my head with Sanofi, according to the history of the company, French company present in Africa, it's a little different because we are present on malaria, we are present on dengue, of many types of disease, and thank you, but we have to adapt the business model because it's a very important one. The responsibility for the big company, responsibility for the politician, for international organization, and I think somebody speaks about partnership, and partnership is a very important sustainable development goal. It's number 17 to say, if we want really to fulfill the gap, climate change or not climate change, but it's a big link, we have to work together. Time of polemic, we have a lot of political polemics. We have, if not, we will really enlarge the gap. Mm-hmm. And we have, each one can bring his specific stone.
How this business model can be changed? How?
Price, I told you, to change a policy of very high margin and low volume to big volume and low margin. The growth will come from the south. And there is a place where the needs are so important. And this is the interest of pharmaceutical industry. And I can tell you, I was head of the Red Cross. I made medicine in my life, many things in my life. We can say the good are in one side and the bad in another side. It's much more complicated. Each one has its own responsibility, as we have no choice. We have no choice. We can go against the general public, against the image and reputation of a company. Sanofi and another one is a part of the DNA of the company now. With a corporate social responsibility, with investment in companies that respect some specific parameters, it's something very important. It's no choice. That's why we have to avoid this type of thing and to adapt. This is also adaptation.
What's preventing this change?
Sorry?
What's preventing this change in the business model that you just mentioned?
Is no choice. This is the pressure we say in the morning, African, you have to take your destiny in your... Is a pressure of the population. Is a pressure... Take the example of the Pretoria trial with the HIV, access to HIV drugs in South Africa. They say, oh, we want to overcome intellectual properties, was big trial, and everybody, all the world say, oh, these pharma industries are very bad, they don't give access. It was a big trial, but suddenly they say, oh, all the world is against pharma industry, and they withdraw the trial. And it was a strong awareness. And the awareness is not only for big pharma, it's only for everybody. And again, it's not the good in one side and the bad in another side. It's much more complicated. We have to work together. We have no choice. We have no choice.
Okay. Thank you. Let's go back to the dead. Sorry. Sorry. So, Ildi, one of the forensic techniques in your job is to analyze insect life of the dead body. How climate change will affect your work?
Yes, that's very true. So one of the techniques that we use, or that my colleague uses quite generally, is forensic entomology. So when a body dies, when a victim dies and a body is found, there's a variety of insect life that may be present. And it's this assessment of the insect life that can help the pathologist as well as the investigator of that particular victim and that victim's death as to what his post-mortem interval is. And because these kind of standards are very well established, the insect life, the larval developmental stages is very well known, the forensic entomologist uses that to backdate, to come up with a forensic timing in terms of when that person may have died. And with temperature changes and temperature fluctuations and people migrating and people moving and, you know, there's a confusion in the insect life. And when a scientist is making a decision and trying to establish a forensic time of death, that can actually be complicated because the temperature can impact on the insect life or the developmental stage of the insect, and then you have basically a misinterpretation of that time factor that's been decided, and that can cause a problem because if you do catch a perpetrator and you want to confirm his alibi or the information that he's relating to you based on that victim, sometimes it's quite hard when you might say that it's a certain kind of insect and that person may have been alive 3 days and the perpetrator has a perfectly good alibi for that time period. So that is one of the ways that it impacts on the forensic side of things. When it comes to, like I said, the dead people, many people, the obvious concern and the obvious political emphasis is on the well-being of the living, and is to ensure that they continue to be living. So when it comes down to our stage of assessment, sometimes people forget that we are able, once we open up a person, we are able to highlight tuberculosis, we are able to highlight meningitis, we are able to give perhaps a more disconcerting or snapshot of what's currently happening out there in society.
So you're a precious source of knowledge.
We are. Just say that loud and proud.
To keep those alive,
yes.
living more.
Very much so.
Okay. So now, from the dead, let's move to the genes. Alexandra, by reading your...
or to the children.
Yes. By reading some of your publications, I understood that there are genes that react differently to heat. What's the importance of that? And I'm sorry for my ignorance on your topic.
Whatever condition, again, influences your genes and turns on such and such information. Heat is one of them. And to respond to heat, we have different capacity. That is to say that we are unequal to face heat stress. And that again comes back to not mitigation, but genetic adaptation. And genetic adaptation is on the same generation. That is to say, I am genetically adapted to whatever condition comes across my own life before I'm dead. And in ways that, so that you have either thermotolerance, so that's the way you'll be able to handle the change in temperature, or you have the possibility of getting acclimatized to the change of heat, and in the way your organism reacts, you will increase the possibility to work during when it is very hot. And it's very vital to be able to work when it is hot. And the way you do so, you do it by increasing the dissipation of the heat. So how the way I will get acclimatized to heat will be by dissipating how fast I will be able to dissipate the heat that I'm facing. So that's the way we are genetically determined to answer this kind of struggle. And it's true that we tend to have a very simple view on diseases and say, oh, we need to eradicate any sort of disease. But if we take Africa again, we have sickle cell anemia. Sickle cell anemia is about the shape of the red blood cells. So in your blood, they will take a very angular kind of shape. And in fact, it turned out that the reason why there was so much sickle cell anemia in these countries was because it was a better, it was an adaptation threat against malaria. We also have, so that there are other examples of other disease like lactase deficiency. Lactase deficiency is again an adaptive threat that can enable you to react to different kind of infectious injuries and assault. And the reason being that you don't drink so much milk in Africa as you do in Europe, for instance. Okay. So those are, the kind of changes, and whenever we want to eradicate something, we just have to step back a bit and understand why the nature has made it that way, and do we need it or we really need to stop?
Okay, thank you very much. Let me just go back to some more general questions. I mean, climate change to many people is something abstract. It's about the polar bear in the Arctic. Is the public in general, maybe I'll start with Nick, aware of the risks climate change are on their health?
Sure. The answer is it varies between the countries you look at. There are only 2 or 3 large global surveys that look at public perception of the threat of climate change. One by the World Bank that is done once every 7 years, and one by the Pew Research Center. Broadly, the answer in terms of sort of awareness or perception of threat is that for the most part, people are aware that climate change poses some sort of threat to them. For the most part, they're aware that it's going to influence them. Whether or not they know it's going to influence their health necessarily is not something that sort of is drawn out by these particular opinion polls. But then the question becomes, yes, it's going to influence your health, but how much do you care? Yes, it's going to influence you, but how much do you care about climate change relative to concerns about immigration, relative to concerns about education, about health, about other pressing issues? There aren't that many global opinion polls. There are no global opinion polls that look at that specifically, and I think that's why I would sort of second the point that you were making is parts per million of CO2 equivalents in the atmosphere is a very sort of abstract concept. It's not something that we understand as individuals, unless for the climate scientists in the room, I'm sure it's far less abstract.
So some people wouldn't even know that the child just sitting next to you might be being heavily affected by climate change. That's what you mean? Is there a communication problem?
Yeah, there very much is. And a big part of that had come from previously the way that we ran, the world sort of ran its climate change science. Previously, you used to only be able to say climate change will increase the frequency and severity of an extreme weather event such as. About 3 or 4 years ago, with the development of a whole range of new technologies and some very, very clever mathematics, something called a detection and attribution study now lets us identify specific events and say that event was 90% more likely to have occurred as a result of climate change. And going back for the last 30, 40 years, we've been able to identify extreme weather events that were happening and saying that event wouldn't have happened, or if it had happened, it wouldn't be anywhere near as dangerous for human health as it was. And that's going to help, I think, as that level of science and the engagement of the climate science with epidemiology and with public health specialists increase is going to help provide almost the ammunition for that communication that you're talking about.
Well, climate change will put a lot of stress on health systems. How unprepared health systems are? Who would like to answer this question? Today in Africa and in the small islands.
No, it is sure that it's an opportunity, perhaps. I will use this word as an opportunity with climate change to come back about the health infrastructure, how to put money on health again, to respect the commitment in Abuja of 15% of the budget for health. But according to the different survey made, I insist that if you speak too much about greenhouse footprint, carbon footprint, for the people it's something very far. If you speak about consequences on health of children, of some specific diseases, you know, they will feel really involved. Take an example of some country. If you take Vietnam, for example, you have the Mekong Delta. The Mekong Delta is producing rice not only for Vietnam, for the rest of many countries in Far East Asia. With flood now, it's a big risk with the increase of the sea level, disappears the Mekong Delta. If you take the increase of flood in Bangladesh, it's something that very few people speak, is snake bites. When you have flood, you have the snakes coming out, and you have a lot of people that die by snake. It's something, you know, we have to be aware about that. And the people locally, they are completely aware. And I think when you speak about consequences on health, you touch agriculture. If you take the increase of acidity of the sea, you have decrease of fish stockpile. If you have a decrease of fish stockpile for some population, you have food problem, nutritional problem. If you have nutritional problem, you have diminution of the immune system. Perhaps you can have adaptation, but you need time for that. And so forth. You have many examples like that. And I think it's very important to put the finger and to communicate on the political level, in industrial level, in all the newspaper. We have many colleagues from newspaper to say health is very important one. And when you touch health, you touch agriculture, you touch health, and you will give a strong awareness to the people. I think it's an emergency. Somebody say in the morning we have to invent our future. And this point is a very important one.
Thank you. So how to strengthen health systems? Maybe Alexandra and Ildi, strengthen the health systems. We're going to have major dramatic changes with climate change.
Well, that's a very difficult question you're raising, and it's nothing linked to climate change. How to strengthen the health system in Africa has been a real challenge for the so many years before, and is still currently an intense issue. So one aspect that I see very practical would be to, instead of educating doctors, MDs, after those 10 years or whatever, to educate more people 4 to 5 years that are readily able to go into remote places, because that's the one big issue in Africa, is to go to these remote places. I've been in some in Comoros Island, and I can tell you they can be very, very far from any sort of civilization or kind of care system. And so if you have more of them, then you can be able to face and adapt in a reactive manner. Somebody said in a previous session, neighbors are a fantastic help as well, because if you don't have the possibility, you have a neighbor that can eventually warn somebody else, and this is very practical. Another possibility is using animals. Animals are fantastic sentinels for climate change, and they are not used or hardly used. For instance, cats can be fantastic sentinels for mercury poisoning. And when there was the tsunami, suddenly people looked at the elephants and they realized that they were breaking their chains to run out from the tsunami. So, you know, taking animals or chicken can be as well. They are reservoirs of West Nile virus. Again, they are very good sentinels to be looked at. So to have a better integrative view on how animals relate to us and plants relate to us is, to me, a way of improving health in a global manner. And the reason being is that we are all interconnected by, so whenever I eat rice, for instance, the little genetic information of the rice is going to turn on a number of reactions in my own body. So food is obviously, again, a possibility for you to sort of react if you don't have anything better than that.
Wonderful. Thank you very much. We've got 15 minutes now. Why don't we open the floor for questions? And I'm sure you've got many questions in the room. So let's start here by the lady there. Yeah, can you raise your hand again? Can you please identify yourself? Yes.
Good afternoon. I'm Evelyn Gitau from the African Academy of Sciences, and I'm really glad to hear someone talking about health in relation to climate change, because I've been talking about the relationship between malnutrition and how many more malnourished children we're going to have in the next 10 years because of climate change. But in the morning, I kept twitching here, wanting to talk to the ones who were talking about indigenous vegetables, and I wasn't hearing them talking about the fact that actually you could drive demand by highlighting the fact that the health benefits for that would be raised. So for example, are the agriculturalists talking to the health practitioners who are feeding or creating foods for malnourished children so that they can drive that demand for their products in terms of health? And then secondly, in terms of drugs, I always turn back to the big pharma. Yeah, it's all well and good to say we will bring down the price, but it's not happening. We don't have policymakers in the room who actually look at different ministries, and intersectoral relationships need to be built so that the research is actually linked to the health and vice versa. We're talking still in silos, so it's something that we need to address and start talking to each other in a way that drives the demand as well as drive the solutions that we need.
Do you have a question?
Just a comment. That's fine.
Okay.
If I can comment on your point, I think we had a very good news last year, which was the Nobel Prize in Medicine to Professor Yu Tu, the Chinese, for the sweet wormwood plant being able to treat malaria. And I think this is a very good way of saying how you can be empowered to actually bridge and establish the link between solutions that you have readily at hand, because obviously these kind of plants do grow easily, and to treat immediately the patients, or to prevent, because it has also a role in prevention to malaria. So, and that's actually the reason why I've come to Mauritius. It's because I'm convinced that this kind of solution, using the work from Amina Gorib, Madame la Présidente, on medicinal plants, is a fantastic opportunity for Africa to establish the bridge between health and those traditional observations that they have had for so long.
Any other questions?
Yeah, I'm very glad to hear about the issue. Actually, health is becoming one of the major global problems connected to climate change. We used to know 5, now health is number 6. And like, for example, we have the case of diabetics, non-alcoholic fatty liver issues, and the lack of nutrition and so on. We have the malaria case. It comes because the massification of irrigation in the highlands to mitigate drought problems becomes an area for malaria issue. And that's we call always for integrated adaptation planning without introducing negative effect to the people. The people in the highlands, they don't know how to manage malaria. It happened to me, I was co-infected by both malarias during my visit to Burkina Faso, traveled to Sweden. I was admitted for a hospital. I don't know even the symptom of malaria before. It was my Ugandan friend, she told me, please tell them you have malaria. She saved my life. Because they took time to investigate and you know what will happen. It's really the worst disease. Now, my question is, we have been reading so many articles like out of 12 dangerous chemicals, 9 of them are pesticides. We have a lot of occurrences like cancers. People are dying out of cancers. And the public is interpreting it because of the new food, because of what, because of the technology interventions. I want to ask you if you have an evidence or if you came up with a research result, if any interventions has brought, you mentioned the effect of insect, like, we have insect-borne diseases. Dr. Saganat was advocating that we have to promote insects. This world is very complicated, and, how can we be together? And is there any experiences that we work together, health versus agriculture or whatever? So I really need some practical examples if cancer is also related with this.
If I could just mention, when it comes to pesticide, it's one of my projects. One of my students is working on pesticides, but really from the point of view that our problem in Africa is that a lot of people swallow pesticides. They commit suicide, very much like the Indian situation. Pesticides, as opposed to the Americas or the UKs or the Australias, they don't have such an issue, and it's because pesticides are so available and it's so widespread, and we have a terrible problem actually where certain kinds of pesticides are sold on informal markets and people get a hold of it, and it's very readily available. So when it comes to a forensic side, the number of deaths due to agricultural poisons is quite high, and actually is quite significant. So unfortunately, I can't answer your question in respect of cancers, but what you say is very important, because at the end of the day, it's all about communication and not working in isolation. We're all connected, we're all a chain. One of my collaborators with whom I really wouldn't be sitting here is Dr. Kharebe, and she works at the Occupational Institute of Occupational Health, and she's very enthusiastic about working together and us working jointly towards the connections. And that's really what it's all about. Why should we work in isolation? We should all really be pulling in the same direction when it comes to health issues, because nothing is independent. We all have a knock-on effect. Okay, my domino's really right at the end, but who's to say that the information that we can all bring towards a interest like cancer, or a disease like tuberculosis, or a genetic issue, why is it that we can't just share the information and all work together to get that knowledge out there? And we have young, enthusiastic scientists out there just eager to make a contribution. And maybe that's what's lacking. That and resources and funding, really, at the end of the day, that it's very different to overseas, where that you have a research institute. It's very hard for us, especially something very new like forensic medicine and pathology, where it's a factory of dead, really. But there's so much to learn from it. There's so much research that can be done from it, but not directly.
Very interesting. Break the silos, right? Yeah. And share the information. I think Robert has a comment on that.
I am not sure, Madame, to answer about your question about cancer, but with the help with Alexandra, perhaps we'll try to give you some direction. It is sure that the increase of microparticles in the air, the pollution, can perhaps induce some modification of the genes, and we know some modifications of the gene can increase also the probability of cancer. we try to find a way. You know, I am not against research, not at all. And with Alexandra, perhaps you will help me to this type of thing, but it's certainly a link between pollution, increase of microparticle, and perhaps some toxicity on genes.
Basically, any stress will cause the possibility of an alteration in your genes, and that the genes that make your cells proliferate, and that's when it will turn into a cancer, because the cell becomes crazy and sort of divide endlessly. So that's you're right, and basically I think that in Africa it's more the UV can be as well a cause, but then again you have melanin that will protect you. So you have different kind of causes. In terms of air pollution, it's difficult in Africa because we don't. I mean, it's the 4th leading cause in the world of death in the world. But the thing is that in Africa we lack data cruelly, and they have put together a program that is ongoing to have a sort of a set of observation of how critical it is and how does it affect. I know it affects in South Africa, but because there are more urbanization probably.
Thank you. Before I pass on to the next question, there is an important issue. I mean, the effects of climate change on health will not be evenly distributed. So who will be the most affected? We've got a room full of women here. I believe women are very vulnerable. Nick?
You're exactly right. The impacts of climate change on human health, on human well-being, are unevenly and unfairly distributed throughout the world, especially when you consider where the majority of the historical causes of climate change come from. In terms of trying to sort of disentangle who is most vulnerable to climate change, there are a few sort of broad generalizations you can make. Firstly, there are countries and regions of the world that are more exposed to the elements. So these are places like small island developing states. They are mountainous regions, and they are, for the most part, sub-Saharan Africa. But then within those sort of environmental exposure generalizations, you can also draw out and look at the impact that the social and the political system that a country sort of has in place and how that interacts with climate change itself. If you were to unleash the same sorts of impacts from climate change on the United Kingdom as you were on Mauritius or on another African country, you would find very, very different impacts. And that's because the UK has the National Health Service in place. It has a functioning system there that is able and capable and has the finance to be able to respond. So when you wear away at the sort of social systems in place for a country, that's when you become more vulnerable. Within countries, again, then, it's no surprise that it is marginalized populations. It is not uncommonly women that are most affected by. We know women disproportionately most affected by extreme weather events, and that's a very broad generalization that you can for the most part make around the world. And so it's a question of small, low, middle-income countries that don't have the capacity or the ability to respond that are going to be disproportionately affected.
Thank you very much. Let me take one more question from the lady.
Thank you.
There.
Rama Sofia, the United States Press Agency. My question goes to Mr. Roberts. As you said that I'm glad that you're eager to work with Alexandra, which is a good news. In a larger scale, my question goes the opposition that is classically we oppose the natural therapy to the pharma business, which has interest, and we can understand that. But is there any way that we can merge the natural pathologies therapies to the pharmacology, knowing that the pharmacology comes from the pharmacopea that is natural, by the way. So to solve the problem and to put the human being in the center of this. Thank you.
I think we have no choice. You take the example of artemisinin. Myself, I develop a compound with artemisinin, and I work with some Chinese farmers about that to treat malaria. And we know some active principles are coming from plants. what is very important is to exchange the knowledge of some tradi practitioner in the country, but to share, but not to steal. It's why we need an agreement in terms of a patent, in terms of intellectual properties. And also when we want to work in some country, and mainly in Africa, and this is what I say to my team, and even myself in a previous life, we have to work with the tradi practitioner because they know the community, they speak the same languages. And if you are coming, oh, I am coming from France, I know everything, I give you the good drugs, you are nothing, you're stupid what you are doing, you will lose. And I think it's very important because they are the leader in the community in terms of cultural presence, in terms also of the knowledge, and empirical knowledge. And from empirical knowledge we can work because we have some tools in terms of screening to know what is active in such a plant. So the discovery of artemisinin was empiric, still many centuries. And I think this point is a very important one. And just I want to come back about the woman. I think the women, they are the victims, but also is a chance. It's why we have to target everything on women, because the women, they have the direct contact with the children. And now education is very important in terms of awareness. To explain to the mother the link between the mosquito and the disease, for example, we conduct some surveys, they didn't know. And when you make some specific training, they will use bed nets, they will use treatment, they will use many things. And I think now they are a victim because we have seen that the women, they produce 80% in terms of food, working on agricultural, many things. But also if we target our action on women, it's a good and very big chance.
Okay, invest in women. Oh, wonderful. I think I'll take one more question, the very last one, a brief one, if possible.
So my question is a really brief one. You mentioned that there's a lack of data, especially coming from Africa. Now, this is a general problem, but in particular in the health sector, this is even a greater problem, especially when you're talking about working together. And this is an issue we are facing. A lot of the data around Africa is not owned by Africa. It's coming from other people who are telling us the problems around us, collecting their data, and we Africans have no access to the data. So my question to the board is, in your various fields, is anybody collecting data, and who owns the data, and is it accessible to Africans so that we can do research and we can collaborate across the board? That's my question.
Well, for the study I was mentioning earlier on air consequences on respiratory diseases, it's true that the data is being collected by the Imperial College in London, but as far as I know, the African teams are involved in the whole study. So it's not like anything is being stolen or it's just from Africa. So that I
am sorry, I will be very direct in terms of my answer. And some politicians, they are here. They have information, the politicians. You have African Union organization. They have the data. You have a regional office of WHO in Brazzaville covering all the country. They have this data. And I think you have to put pressure of health authorities in your country to receive this data. This data exists, and I can tell you, I had 10 days ago a meeting with the new director of WHO, Dr. Moeti, and I know she's completely aware of the problem. And they have to share with a different country, with the population. Really, I don't want you to say, oh, the white people, you know everything and you don't want to share information. The information exists. The information exists at the level of Africa. We have to be direct. We have between us. And I think you have to put pressure in your government, in your Ministry of Health, in the WHO office in Brazzaville. They have the data and they have to give you the data to perhaps induce some answers.
I think we're coming to a close. I thank you very much, this panel. I certainly learned a lot from you, and I'm sure the public as well. Thank you very much. I'll pass you on to you. Thank you.
Thank you very much, Deborah. Thanks to all of our panelists. Very interesting. You could tell by the amount of questions.